Hello, everybody. Thank you for joining us today. I'm Gautam Raghavan, and I currently serve as an advisor in the White House Office of Public Engagement. And we're really excited to have you all join us in this Google Plus Hangout today. This week is National AAPI Enrollment Week of Action. It's a week of action in which we're going to focus on what the AAPI community and our families should know about the Affordable Care Act and what you can do to help get them enrolled by March 31st. Before we get started, I'm really excited to introduce to you our participants who are on this Hangout today. We'll be answering all your incredibly important questions and the ones that we got from you and the rest of the community. First, we have with us Dr. Howard K. Koh, who is the Assistant Secretary for Health at the U.S. Department of Health and Human Services. Dr. Koh is a first-generation Korean American and the first Asian American to serve in this current position. And he has been an extremely powerful advocate and champion for the AAPI community. We're so excited to have you for our conversation today, Dr. Koh. Thank you for joining us.
Thanks, Gautam.
Next, Dr. Meena Seshamani. Meena is the Deputy Director at the Office of Health Reform at the Department of Health and Human Services. Meena, thank you for joining us too.
Good to be here.
And certainly not least, a face that many of you will recognize, Maulik Pancholi. Maulik is an American actor known for his recurring role as Sanjay on Weeds, his role as Jonathan on 30 Rock, and as the voice of Sanjay on Nickelodeon's animated series Sanjay and Craig. Thank you, Maulik, for joining us as well.
Thanks for having me.
So thank you all for taking the time to be with us in this incredibly important time right before the enrollment period ends on March 31st. So let's begin with the questions that we received. The Affordable Care Act, also known as the health care law, and as we like to call it at the White House, Obamacare, was created to expand access to affordable health coverage to all Americans. So, Dr. Koh, I'd love to hear from you. What's being done to get the information out specifically to the AAPI community?
Well, we're very pleased to work with so many leaders throughout the country to get the word out about the Affordable Care Act. We're honored to work with community leaders, community-based organizations, health centers, hospital leaders, the business community, and we even get a chance to work with Hollywood actors like Maulik today. So many are involved in getting the word out, and we're very proud of that effort.
That's great, and if you could help us understand, if folks want information, where's the best place for them to go?
Well, we have a website, healthcare.gov, and we encourage people to consult that website through the internet. We also have a 1-800 number. If you call that number 24/7, there will be a professional there ready to take your questions and also answer your questions in over 150 languages, many of them Asian languages. That number is 1-800-318-2596. So we encourage people to consult the website or call to get more information about coverage.
Thank you, and I'm going to sound like an infomercial, but I'm going to repeat the 1-800 number. It's 1-800-318-2596. Call now. Operators are standing by. Meena, could you talk to us a little bit about what are the benefits of the Affordable Care Act?
Sure. Well, one of the main benefits and one of the reasons that we're here today is that the Affordable Care Act makes health insurance affordable and accessible for people living in this country. And that's something that's really important. Having health insurance will enable you to go see a doctor, to stay healthy, and it also prevents you from having to deal with really high costs of care. You know, for instance, if you were to break your leg, it could easily cost several thousand or even $10,000, hospital visits, and things can happen even if you think that you're healthy. So it's really important for people to enroll through these marketplaces, which are basically these marketplaces where you can shop for insurance plans, and many people are eligible for premium tax credits. In fact, 8 out of 10 AAPIs are eligible for premium tax credits to help make these health plans affordable. And the health plans cover the wide range of care that people need, including ambulatory care, prescription drug coverage, hospital care, emergency care, and so it's really important for people to take advantage of this and go sign up today. So now I can sound like an infomercial too.
Well, we all will a little bit, but that's okay. So Dr. Koh, help us understand, why is it better for folks to sign up through the marketplace as opposed to buying through an insurance company?
Well, the marketplace has been very carefully constructed so that if you apply through the marketplace, you can get coverage and also be eligible for tax credits that can lower your premium costs. So that's really important because so many people find health insurance unaffordable, and every effort has been made to make insurance affordable through the marketplace. That's why we encourage people to consult the healthcare.gov website and also call that 1-800 number.
Got it. And Meena, can you tell us the health insurance that's offered through the marketplace, where does that come from? Is it from the government? How does it work?
The health insurance plans in the marketplace are private health insurance plans offered by health insurance issuers. They go through a process of certification, which confirms that they're offering those benefits that I described. There are 10 standard categories of benefits, essential health benefits that all these plans must offer. And they also have to follow things like not charging exorbitant rates. Their rates are reviewed. So there are other things as well that go into the certification process, but they are all private plans.
Got it. And I think you mentioned earlier 8 out of 10 AAPIs qualify for financial assistance. Dr. Ko, I believe that yesterday the department released a new report on Asian Americans, Native Hawaiians, and Pacific Islanders, and the kind of financial assistance they can receive. Could you tell us a little bit more about it?
Sure, we're very pleased about this report because it documents that of the millions of people who are currently uninsured and eligible for new insurance coverage, about 1 in 20 are members of our community, that is the Asian American, Native Hawaiian, and Pacific Islander community. And when you add it up, that's about 2 million people who are currently uninsured who could benefit from new coverage. So that's very important. That's new information for our community. I'm a physician, so I've seen the impact of lack of insurance on people's health, and so this is a new opportunity for all of us, and it's very, very important. As Dr. Seshamani has already mentioned, some 80% of people in our community can also possibly get tax credits and also be eligible for Medicaid and Children's Health Insurance Plan coverage. So this new coverage can be very affordable, and that's a very important message.
Got it. And that 2 million number, so who's included in that?
So this report is specific to our community. That's Asian Americans, Native Hawaiians, Pacific Islanders, or those who come from a combination of those backgrounds.
Got it. And do we have a sense yet of how we're doing, or how many individuals have enrolled in the marketplace so far?
Well, this has really been a historic effort, and this week the numbers have been updated, so now over 5 million people have enrolled in new insurance in the marketplace, and the marketplace is available in every state in the country. So that's the good news. We want those numbers to keep rising, and we only have 12 days left in open enrollment because the enrollment period ends on March 31st. So that's why we're having the Hangout today, and that's why we're doing such outreach with so many partners across the country.
Got it. And I think, back to that report, if I recall correctly, it said that if we were to expand Medicaid, that up to 9 out of 10 AAPIs would qualify for financial assistance. Can you tell us a little bit about how Medicaid expansion could help our community?
Sure. I hope everyone knows that through the Affordable Care Act, states have the option to expand Medicaid, and if the states do that, we can cover more people. Right now, some 26 states and the District of Columbia have decided to expand, and that helps our community, the Asian American, Native Hawaiian, and Pacific Islander community. If we have every state expand Medicaid sometime in the future, some 90% of our community that's currently uninsured could get new coverage, affordable coverage that's associated with Medicaid, CHIP, or tax credits to help with premium costs. So that's the vision and hope for the future.
Okay, and Meena, is there a deadline for Medicaid expansion? How does that work?
No, states are able to come in as they make decisions. And I will say right now, with the 26 states in D.C., there are more than 700,000 Asian American, Native Hawaiians, and Pacific Islanders who are eligible for Medicaid coverage, and that number could increase to 800,000 if all states expand.
Got it. And that gets us closer to a 9 out of 10, I think, as Dr. Ko said. That's great. So Malik, let me ask you, we talk a lot about healthcare reform and Obamacare here in Washington, D.C., but for you, what sort of brings you to the conversation? Why do you care about health insurance? And as an actor, why do you think it's important for folks to get covered?
Yeah, I have so many friends who don't have health insurance because they just can't afford it. And I think that Obamacare finally provides the opportunity to have affordable health insurance. And for me, just being a citizen of a country that values the health of its people is really, really important. And I think that this is the Obama administration saying, like, we care about citizens of our country. We want everyone to have health insurance, and we want people to have health insurance that they can afford. And, there's so many actors I know who don't qualify for the minimum amount of earnings you have to get health insurance through the union or whatever. And a lot of these people just don't get it because they feel like they can't afford it. And you know, I also hear this argument from people all the time that they're perfectly healthy. They hardly ever get sick. Why pay for something now that they're never going to use? And the fact of the matter is that there's a really good chance that you will have to use it. You know, no one plans to get sick, no one plans to get hurt, but it's just a fact that most people will need to get medical care at some point, you know. And for me, as an actor, it could be something as obscure as I do a couple of voices on cartoons. You mentioned the Nickelodeon series Sanjay and Craig and Phineas and Ferb, and a couple of months ago, I was going through this period where I felt like I had a vocal strain, and I wanted to go see an otolaryngologist. It's a pretty expensive visit, but because I had health insurance, I was able to go see an otolaryngologist and find out that, in fact, everything is totally fine with my vocal folds and no one needs to freak out. The cartoons will go on. But I know that most people are not going to see otolaryngologists. But, you know, for me, that was something that I was able to do because I had health insurance. But I have a family member who is totally healthy. So healthy that she's outdoorsy, she hikes a lot. She went hiking a couple months ago. She slipped on a loose stone while hiking, fell down, broke her wrist. Because she's covered, it was very easy for her to go to a hospital. It was very easy for her to go see a doctor, you know. And we all want the best case scenario to always exist, that we're all healthy, we're all totally fine. But you never know what's going to happen, and if a worst case scenario presents itself, health insurance is the thing that could protect you from some very, very high expenses.
Yeah, and by the way, I'm so impressed that you used the word otolaryngologist.
Yeah.
So I am an otolaryngologist, so I am very pleased you went and saw an otolaryngologist.
Now, if we could all spell otolaryngologist, I'd be really...
It's actually otolaryngology, head and neck surgery is the official name of the specialty.
Look at that.
Well, look, we're all learning something tonight. Well, Val, you mentioned, obviously, you know, your own story and stories of someone you knew. And for me personally, I think for many of us, we've heard all sorts of stories of folks all over this country who either didn't have health insurance before and now they do, or had something really horrible happen in which they had coverage. So are there any other stories like that that have really touched you and made you think about health insurance a different way?
Yeah. You know, it's as you start to dig into some of this stuff, and as I've gotten more involved with this, some stories have definitely come my way. And so recently, I heard this story of a woman, and she's Hmong American. She's a single mother. She lives in Minnesota. She's got 6 kids, and she has not been able to get health insurance for the past 8 years. But because of the Affordable Care Act, she was able to go to healthcare.gov. She was able to sign up for a health plan that finally she could afford after 8 years of not having health insurance. And a week after she signed up for the health insurance plan, she was able to go see a doctor for abnormal bleeding that she was having. She was able to get a biopsy while she was there to determine if the cells that were causing the bleeding were cancerous or not. She was able to have immediate surgery. She was able to stop the bleeding, and she is a huge success story. She was very lucky. Her biopsy results came back negative. Her bleeding stopped. And I think the most amazing part of the story is that now she and her 6 children have health insurance. They're fully covered. They're free from worry. So if something like this came up again, you know, let's hope not, but if something like this came up again or something came up for her children, she can live worry-free knowing that she has health insurance and she can go see the doctor.
Yeah, I think that's an incredibly powerful story and really puts a human face on an issue. You know, Dr. Poe, one of the questions that we've gotten a lot over the years has been, who's eligible to use the marketplace?
Sure, there are several major criteria. First, you have to be living in the United States. Second, you have to be either a U.S. citizen or a qualified non-citizen, like a permanent resident. And third, you can't be currently incarcerated. And if people have questions about eligibility, they can certainly go on to healthcare.gov because there's a lot of information there that's easy to understand and could apply to you.
Got it. And Meena, can you tell us a little bit about immigrant communities? Because obviously a lot of folks who are Asian American or Pacific Islander are members of immigrant communities. So if you're an immigrant, what do you need to know, or what do you need to do to enroll in Obamacare?
If you are a lawfully present immigrant, then you do qualify for coverage, so you should have your document numbers ready when you go to healthcare.gov or when you call the call center.
Got it. And does, I know there's been a lot of concern about, does applying through the marketplace affect your immigration status? I mean, Dr. Koh, could you tell us a little bit about what do people need to know if they have families that include immigrants?
Sure. The message is that we need to focus on health and health coverage here. So applying through the marketplace does not affect your immigration status. It does not affect one's chances of becoming a permanent resident or a U.S. citizen. And so we want the focus to be on health and getting people the insurance they need and deserve.
Got it. That's great to know. And another question that we get a lot after immigration is about folks who don't speak English well. I think the statistic is 1 in 3 Asian Americans is limited English proficient. So, Meena, if I'm a member of the community and either I or someone in my family doesn't speak English well, where can I go to find help?
I would encourage people to call the call center where, as Dr. Koh mentioned, many different languages are represented, and the call center can then also direct people to assisters in their local community who can speak the language and help them in person. And so just to repeat, that call center number is 1-800-318-2596.
What was it again? 1-800? Sorry, no, really, what was it? 1-800?
1-800-318-2596.
Great, thanks so much. Obviously, we're trying to get the word out. It's really important over the next, 12 days left until March 31st is the deadline. And one of the ways we're trying to do that is over social media. So, Malik, I know you're big on social media. So do you have any suggestions or messages for folks on how they can use it to get the word out?
As a matter of fact, I do. Although, I just wanted to point out something that I didn't mention earlier in that, as I've looked into this stuff, I found out information like, for example, the average cost of having to stay for, let's say, 3 days in a hospital could be up to $30,000. So I just think it's important for people to know that if the getting coverage now can prevent the possibility of going broke in the future, the possibility of really not being able to pay for your medical bills. So I just want to put that out there. And also, so social media. So there's a campaign that's going on. It's called #GetCovered. And what you can do is you can go to whitehouse.gov/getcovered. You can print a sign. It looks like this. I'm not sure what you guys can see. It looks like this. You can print it out, and you can write anything you want in here as to why you think people should get covered under Obamacare. And I was thinking of some things to say. At first, I thought of get covered because I told you to, and I know everything. I thought that was maybe a little aggressive, and in fact, I don't really know that much. But maybe perhaps a more real one is get covered because it is affordable, and you are worth it. You deserve to have insurance. So here's my little sign, and what I can do with this sign is I can take a selfie. I'm going to do it right now. There we go. I'm not going to show that to you because I'm going to tweet it. And if you want to see it, you can go to my Twitter. It's at Malik Pancholi. And also I'm going to hashtag it, #GetCovered. So go find it, retweet it, create your own. Hopefully they'll be funnier and more interesting than mine. And if you tweet them at me, at Malik Pancholi, I will retweet you because we really want to get the word out. Just spread the word. Is it 12 days? There's 12 days left?
12 days.
12 days left, and we should get those numbers up as high as we can. Everybody deserves to have health insurance.
Great. Well, I certainly don't want to keep any of you. I know you're all busy, especially getting folks covered in the next 12 days. So we've got some great questions. So let's just wrap it up. And what I want to do is give each of you just a chance to say anything you would like to say in closing. So Malik, why don't we start with you?
Sure. Yeah. So I'm an actor. So one thing that people say to me a lot is break a leg. I get that a lot. Break a leg tonight, break a leg. But the thing is, if I actually broke my leg, it would cost me probably like $7,500 to go to the hospital and have that looked at. So if you're a young actor out there, if you're a singer, if you're a dancer, and people are saying to you, break a leg, just every time they say that, think to yourself, maybe I should get health insurance in case I actually do break a leg. It's very important to get health insurance. Invest in it now. You'll be thanking me down the line.
Great, thank you, and thanks for joining us. Meena, any closing thoughts from you?
Enroll, enroll, enroll. This is really a chance to be part of history. I mean, this is really a transformation of our healthcare system, and really a chance for us to take care of ourselves better and for our community to take care of ourselves better. And so I strongly encourage everybody to go to healthcare.gov, to contact the call center, and everybody knows someone who's not insured. And just reaching out to your friends, your family members, your colleagues who don't have health insurance, talking to them about it, giving them information, I think it's an opportunity not to be missed.
Great, thank you. And Dr. Ko, why don't you close us out?
Okay, well, like Dr. Seshamani, I'm a physician and clinician. I've cared for patients for over 30 years, and I can think of countless times that I've cared for patients who were so concerned about whether their insurance would be there to support them that they could scarcely focus on their condition and getting better. So the Affordable Care Act is really historic, and also about giving people a sense of security and giving people the coverage they need and deserve. So we really encourage people to take advantage of these last 12 days, to go to healthcare.gov and really contribute to making this country healthier.
Great, thank you so much, and thanks to all of you for joining us today. And don't forget, again, 12 days left. So Monday, March 31st is the deadline. So please tell your friends, tell your family, your coworkers, your relatives that it's not too late to go get signed up for health insurance. And I want to give a special shout out to all of you out there who are doing this work already, especially to the community health centers who are doing really incredible, important work each and every day in AAPI communities all across this country. So if you're interested, you can sign up today at healthcare.gov or over that phone number, and here it is one more time, again, available in 150 languages, 24/7. The number is 1-800-318-2596. I feel like it's burned into my brain, 1-800-318-2596. Or you can always go to one of these community health centers in your local neighborhood. And you can find more in-person assistance as well in your community at localhelp.healthcare.gov. So thanks, everybody. Again, healthcare.gov, hashtag #GetCovered. Tweet us, find us online, and get covered. Thanks so much, and that ends our Google Hangout for today.